Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about which grains can affect your risk of premature heart disease. In one of the first studies to examine the relationship between different types of grain intake and premature coronary artery disease in the Middle East, researchers found a higher intake of refined grain was associated with an increased risk of premature coronary artery disease in an Iranian population, while eating whole grains was associated with reduced risk. According to the researchers, previous epidemiological studies have reported an association between different types of grain intake with the risk of coronary artery disease. The current study evaluated the association between refined and whole grains consumption and risk of PCAD in an Iranian population. Premature coronary artery disease, or PCAD, refers to atherosclerotic narrowing of coronary arteries in males under 55 years old or in females under 65 years old. It is often asymptomatic early in the course of the disease but may lead to chest pain or angina and or heart attack with progressive development of narrowing or stenosis of plaque rupture of the arterial wall. Risk factors for PCAD include smoking, high cholesterol, high blood pressure, and diabetes. The study recruited 2,099 individuals with PCAD from hospitals with catheterization labs in different cities and ethnicities throughout Iran who underwent coronary angiography. In total, 1,168 patients with normal coronary arteries were included in the control group, while 1,369 patients with CAD with obstruction equal or above 75% in at least a single coronary artery or greater than or equal to 50% in the left main coronary artery made up the case group. Participants were given a food frequency questionnaire for dietary assessments to evaluate dietary behaviors and evaluate the association between whole grain and refined grain intake and the risk of PCAD in individuals without a prior diagnosis of heart disease. After adjusting for confounders, a higher intake of refined grains was associated with an increased risk of PCAD, while whole grain intake was inversely related to reduced risk of PCAD. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.